Welcome to the first video in our series on hypertension. In this series, we will explore various aspects of hypertension, starting today with an introduction, its prevalence, and the overall disease burden. Let's dive in. Hypertension, commonly referred to as high blood pressure, is one of the most significant global health challenges. It affects over 1 billion people worldwide and is responsible for around 9.4 million deaths annually. This condition substantially raises the risk for a number of cardiovascular diseases. For instance, individuals with hypertension are twice as likely to develop coronary heart disease, congestive heart failure, ischemic and hemorrhagic strokes, renal failure, and peripheral arterial disease. Now let's talk about the prevalence of hypertension. It varies considerably across different populations and age groups. In many industrialized nations, blood pressure tends to rise steadily during the first 2 decades of life. In the U.S., before the definition of hypertension was revised in 2018, about 78 million adults were classified as hypertensive. This prevalence also differs across ethnic groups, with non-Hispanic Blacks having the highest rate at 33.5%. Followed by non-Hispanic whites at 28.9%, and Mexican Americans at 20.7%. Notably, among individuals over 60, the prevalence rises sharply to 65.4%. Recent studies suggest that hypertension prevalence might be increasing in the U.S., potentially due to rising obesity rates. The burden of hypertension is vast, contributing substantially to global morbidity and mortality. First, let's focus on cardiovascular diseases. Hypertension is a critical risk factor for cardiovascular conditions like coronary heart disease, stroke, and heart failure. It often coexists with other cardiovascular risk factors, such as dyslipidemia and insulin resistance, which amplifies the overall risk. Another organ system heavily impacted by hypertension is the kidneys. Long-standing high blood pressure can lead to chronic kidney disease and even end-stage renal disease. Studies show that elevated systolic blood pressure, in particular, increases the risk of developing ESRD. Interestingly, hypertension has also been associated with cognitive decline. Some research suggests that uncontrolled blood pressure can lead to vascular dementia and, potentially, Alzheimer's disease. Blood pressure variability and arterial stiffness are thought to contribute to this cognitive impairment. Despite the availability of effective antihypertensive treatments, a significant portion of the hypertensive population remains untreated or inadequately treated. The reasons for this include poor medication adherence and gaps in the implementation of treatment guidelines. This has led to preventable complications and a lower rate of hypertension control globally. Next, let's explore the genetic factors in hypertension. Although rare Mendelian forms of hypertension exist, they only account for a small fraction of cases, less than 2%. For most patients, hypertension is a polygenic disorder, where multiple genes interact with environmental factors to influence blood pressure. Family, twin, and adoption studies have shown substantial heritability in hypertension. Animal models, especially using congenic rat strains, have helped pinpoint specific genetic loci associated with high blood pressure. Candidate gene and genome-wide association studies have identified more than 25 rare mutations and over 100 polymorphisms linked to hypertension. Many of these polymorphisms are involved in arterial pressure regulation pathways. However, there remains a gap between the estimated heritability of hypertension and the known genetic contributions, a concept known as missing heritability. While family studies suggest heritability rates between 34 to 40%, the genetic variants we've identified only account for about 3.5% of blood pressure variability. One theory to explain this missing heritability is the role of epigenetic modifications. These are changes in gene expression that don't alter the DNA sequence itself, but are influenced by environmental exposures. Epigenetic changes may explain how environmental factors like diet, stress, and physical activity impact the heritability of blood pressure. Emerging evidence also suggests that genetic and epigenetic factors contribute to the target organ damage seen in hypertensive patients. For example, left ventricular hypertrophy and nephropathy are common complications of long-standing hypertension. Additionally, specific genetic variants have been linked to the risk of coronary heart disease and stroke. Some genome-wide epigenetic modifications are associated with both hypertension and the risk of future myocardial infarction. To sum up, hypertension is a complex disease with multifactorial causes, significant global prevalence, and an immense burden on public health. As we continue to study the genetic and environmental factors influencing hypertension, the hope is to develop more targeted treatments and improve outcomes for patients. In our next video, we'll delve deeper into the pathophysiology of hypertension. Don't forget to like, subscribe, and hit the bell icon to stay updated.